Dentists take teeth out whenever there's no other option or whenever the patient requests it. Dentists would tend to try to restore the tooth in order to establish function and aesthetics for the patient. However, sometimes there is no option but to extract the tooth. This happens whenever the tooth is completely broken down, whenever the patient is in pain and doesn't want root canal treatment, whenever there's an abscess on a tooth that is just so painful that the patient just wants it out, or whenever the extraction is necessitated by orthodontic treatment. Whenever we need to create space for an orthodontic treatment, we can take out some teeth. Whenever we take out a tooth, there is no way back. The last protocol will be to take the tooth out and potentially in the future put an implant in. Whenever you take a tooth out, there is no way back for that tooth. The space will have to be filled either with a denture, an implant, a bridge, or left as a space. The tooth, whenever it's extracted, will be completely taken out. X-rays will be taken to determine the size of the tooth and how best to remove it. The extraction itself will take around about an hour. Wisdom teeth extractions. Wisdom teeth extractions are sometimes done in the surgery and sometimes referred to an oral surgeon. One problem with wisdom teeth extraction is, especially on the bottom, the roots of the wisdom tooth go very close to the nerve that supplies your lip and the tooth itself. So sometimes whenever you take a wisdom tooth out, damage can be done to the nerve and you can be left with a numb lip. So therefore, risk assessment and very good assessment of the area needs to be done before you go anywhere near a lower wisdom tooth. CT scans may be required as well as X-rays. The benefits of having a tooth taken out is that you are out of pain. From an orthodontic point of view, it means that orthodontic treatment can continue, but the main reason for taking a tooth out is to get you out of pain because the nerve is affected. If the nerve is affected and you're in pain, you have two main options: root canal treatment or extraction. If you don't go for root canal treatment, or root canal treatment is not an option in case the tooth is too broken down, then you have the tooth taken out. That will take away the nerve of the tooth that is causing the pain and relieve you from the pain. So after you have an extraction, you will be quite numb. After any numbing procedure, you need to be careful that you don't bite your lip, your cheek, or your tongue if that is numb. In the particular case of extractions, you have to have something soft. You should try to avoid proper meats like steak, chicken, pork, lamb, turkey, because they can get stuck in the cavity left by the extracted tooth. Those sorts of meats can cause infections and therefore prolong the pain of the abscess or the dental pain. Sometimes after you have a tooth taken out, you get what's called a dry socket. Dry sockets normally happen to people who are smokers. Again, with smokers, the smoking reduces the healing process and therefore clotting agents don't form the clot where the tooth was extracted, and then you can get a dry socket. Dry sockets need to be treated back in the dental surgery, hopefully just on a one-off basis, but sometimes it can be every day for a fortnight. It is really not a nice thing to have happened after you have a tooth extracted. If you're not on antibiotics, yes, you can drink wine, you can drink beer, you can drink whatever, but realistically you should stay off that for a few days, especially during the time that you're numb. After you have a tooth taken out, the pain can go on for around about 10 days. The healing process where the tooth was extracted will take around about 3 months, but as far as the patient is concerned, the healing should appear appear to be finished after around about 10 days. The gum will be a little bit tender, but most of the trauma will be to the tooth that was extracted and hopefully not to the gum or the surrounding area. The longer the extraction takes, the more pain there will be to the surrounding area and the more post-operative pain you will experience. Surgical extraction is one way to remove a tooth. If, for example, there's not enough tooth to grab onto, or if the tooth has been root filled where the tooth potentially will break. Surgical extraction is where you pull back the gum and get direct access to the root of the tooth. You pull back the gum, remove some bone of your jaw to get access to the root of the tooth, and then the root of the tooth is lifted out. The gum is stitched back into place. Generally, if it is planned, this type of surgical extraction is no more painful than the actual extraction itself. And sometimes it can be actually an awful lot easier because it is planned and there's no real trauma to the surrounding tissues except what is planned. Okay, what happens during a tooth extraction? The dentist will numb up your gum, both sides of the tooth, so that the outside gum and the inside gum are numb. The dentist will then test the area to make sure that you only feel pressure. During the extraction, patients will feel a lot of pressure, a lot of pushing, and a lot of anticipated pain. Pain should not be experienced, but the amount of pressure will make the patient feel this is about to hurt, this is about to hurt, but generally it does not. The amount of pressure applied to the tooth during an extraction is intense. That pressure sometimes can be felt as if it's pain to the patient because it is such a lot of pressure, but realistically there is no real pain during an extraction, but certainly it is not something that you want to do too often. Sometimes if there is a lot of trauma to the area where the tooth is extracted, the surrounding teeth will be a little bit sore because it's the same nerve that is supplying those teeth that supplied the extracted tooth. But generally the teeth either side of the extracted tooth tend not to hurt too much. After you have an extraction, the best thing to do is not to eat things that might clog up the hole. Things that clog up the hole will be meats like chicken, ham, pork, lamb, porridge, cereal, and some fruits or vegetables like lettuce. So the best thing to do would be allow the area to heal and not get any food whatsoever stuck there. So the best thing to do would be have something soft, soup, or other noodles that will not get stuck in the extraction site. After a tooth is extracted, a clot forms. We suggest not to rinse your mouth out for around about 6 hours after you have the extraction. This allows the clot to form and to stop any bleeding. However, after around about 6 hours, we do want you to rinse your mouth with either a mouthwash or warm water and salt. What this does, from an osmosis point of view, it stops bacteria contaminating the extraction site and forming an infection or an abscess. So after about 6 hours, we will encourage you to use hot water mouthwashes or another mouthwash to stop infection from taking hold. We'd also want you to rinse your mouth possibly every hour for the next 2 days just to keep any infection at bay. Whenever you do rinse your mouth out, it may disturb the clot and the area may bleed again. So that's why we give you some swabs to bite on and whenever you leave the practice, just in case it does bleed later on. Generally, after a tooth is extracted, the pain will linger there for a few days, perhaps up to 10 days depending on how traumatic the extraction was. Most of the cases that we see, pain will be gone by the next day. As long as you follow the instructions, i.e. avoid certain meats and certain foods, and as long as you rinse out your mouth with a mouthwash or warm water and salt, then generally pain will have gone in 24 hours. You will have some residual tenderness for up to about 10 days, but tenderness and pain can be a little bit different. But you will have some tenderness for up to about 10 days after the extraction. If you'd like to make an appointment at Gallagher Dental, you can do so by phoning us on 01 678 8158. Alternatively, email us at info@gaadental.com, or you can visit our website and book online. The website address is www.gaadental.com. We look forward to having you as a patient, and we'd love to see you and hopefully have a long and rewarding relationship with you.